Well, doctor, that seems like a challenging session. You reassured your client and made her feel better, but I wonder, whose needs are being met? Is prescribing the medication going to help your client, Daisy, the mom, or is it helping the child, Daphlina? It sounds like you're just giving medication to make the mom's life easier, not actually helping the child, and that's definitely not ethical. Also, I don't mean to state the obvious, but you made a diagnosis without assessing based on the diagnostic criteria, not to mention the fact that you haven't even met the child. That's technically a requirement in order to make a diagnosis. I know it may be tempting to just diagnose her with ADHD with the information that the mom has provided, but you still want to make a thorough assessment every time before assigning a diagnosis to a new patient. In addition, great job asking her about any other medication that the daughter is taking, as there are potential drug interaction issues. However, you need to follow through and actually find out what kind of drugs the daughter is on. For example, Ritalin can have a serious drug interactions with MAOIs, and the fact that the mom said that the daughter may or may not have been on something for her mood should have been a red flag. You will also need to remember any sort of disclaimer associated with the use of any drug. Although some serious heart problems alone carry an increased risk of sudden death, stimulant products generally should not be used in children or adolescents with known serious structural cardiac abnormalities. I know it can be difficult to remember all this information about each drug, but it is your ethical responsibility as a prescribing professional to know this information and to provide your client with a disclaimer. Don't be afraid to look up the information to refresh your memory. It's better to be safe than to cause harm to your patient. However, even if you followed the procedures correctly and she were to be diagnosed with ADHD, she is also 6. Ritalin should not be used in children less than 6 years old, and once again, if you can't remember that, just look it up. Lastly, even if you had ethically followed the protocol and properly prescribed Ritalin to Daphlina, you do not want to allow a parent to start using the drug for their other kids. It's no magic pill. Encourage her to bring her other children in so he can receive a proper diagnosis as well.